Have you ever found yourself scratching the same spot over and over and thought, this is so annoying, but it's just dry skin, right? Maybe you wake up at night because the itch on your lower legs will not let you sleep. Maybe there's a patch on your back you can't quite reach, so you rub it against the door frame like a bear on a tree. Maybe your scalp, your chest, or a particular spot on your arms seems to be constantly begging for attention. You put on lotion, maybe even some over-the-counter cream. It calms down for a little while, and then it comes right back. After 60, a lot of people shrug and say, it's just old age. Skin gets dry, that's all. And yes, sometimes an itch really is just dryness, a new soap, or the winter air. But here's the part most people never hear clearly. Some itchy spots, especially when they are stubborn, keep coming back, or don't look right, can be your body's way of whispering that something bigger is going on underneath. The trouble is, itch can feel like such a small thing compared to everything else you might be dealing with: blood pressure, cholesterol, aches, medications, appointments. So you push it to the bottom of the list, tell yourself not to be dramatic, and just keep scratching, especially if you were raised not to complain. Many older adults wait months or even years before mentioning certain itchy spots to a doctor, and by then, sometimes a problem that could have been treated earlier has had a long head start. This video is not here to scare you every time your skin tickles. Itching is extremely common, and most of the time, it is not an emergency. But it is here as a calm reminder that after 60, your skin is part of your health dashboard. Certain patterns of itch, especially in specific places, that won't go away or that come with other changes, can be quiet clues about things like circulation, nerve damage, liver or kidney strain, blood sugar problems, or even skin cancers. The sooner you recognize that a particular itch is not normal for you, the sooner you can bring it up and let a professional decide what matters and what doesn't. Maybe you have already noticed something and brushed it off. An itch on your lower legs, along with shiny, tight skin and more swelling by the end of the day. A patch on your upper back or shoulders that is always itchy, even though it doesn't look like much. An area on your chest, under your breasts, or between your shoulder blades that keeps itching, flaking or changing in color or texture. You might have thought, it's just my detergent, or I'm just getting old, and moved on. But your body may be trying to tap you on the shoulder and say, look again. If you are in your 60 seconds, 70 seconds, or 80 seconds, you might be asking yourself right now, how do I tell the difference between normal, dry, itchy skin and the kind of itch that might signal a bigger problem? Are there specific itchy spots that doctors pay more attention to? When is it okay to watch and wait? And when is it wise to pick up the phone and say, I need someone to look at this? Those are not silly questions. They are smart ones. They mean you are not ignoring your body or panicking over every little thing. You are trying to learn what your skin is saying so you can act wisely instead of living in fear or in denial. This video is not a diagnosis, and it cannot replace your doctor, nurse, or dermatologist. What we are going to do together is shine a light on 3 itchy spots after 60 that are especially important not to ignore, not to make you anxious, but to give you language and awareness. So that instead of saying, it's probably nothing, for the 10th month in a row, you can say, I've noticed this. Here is where it is. Here is what it feels like. And I would like someone to check it. We will talk about an itch in certain parts of your legs and feet that can quietly hint at circulation, nerve, or sugar problems. An itch in your upper back and shoulder area that many women and men think is just dry skin, but sometimes connects to nerve issues or deeper changes. And an itch on particular parts of the skin that may look like just a spot or just a patch, but can, in some cases, be an early sign of skin cancer or other serious disease if it keeps changing or refuses to heal. We will discuss what these itchy spots often feel like, what kinds of changes around them matter, and how to bring them up without feeling like you're making a fuss. We will also talk about other, more common reasons you might be itchy, and how to support your skin in general so that normal dryness is less of a daily battle. By the end of this video, you will not be a doctor, and you do not need to be. But you will have a clearer picture of which itchy spots deserve more attention, what questions to ask yourself, and what information to bring to your next appointment. Instead of just scratching and hoping for the best, you will be able to say, "I know my body better now, and I am going to listen when it talks to me." End quote. And stay with me until the very end, because itchy spot number 3 is one that many older adults ignore for years, covering it with clothing or creams, thinking it is just a nuisance, when in reality, it is one of the most important spots doctors want you to mention early. Understanding that one alone could make a real difference in your future health. Now, let us get started. Number 1. That stubborn itch on your lower legs and feet that never really goes away. Let's start with a place many older adults notice first: the shins, ankles, and feet. After 60, it is common to have drier skin there, but when the itch on your lower legs and feet becomes a regular character in your life, always there, keeping you awake, leaving scratch marks, or living in the same band around your ankles or shins, it deserves more respect than a quick swipe of lotion. You might notice your skin on the lower legs looks different now, thinner, shinier, maybe with brownish or reddish discoloration, swelling around the ankles by evening, visible veins, or patches that look like old scars. You might see little cracks, flaking, or a kind of tight, stretched look. When you scratch, it may break open easily or even bleed. Sometimes the itch is worst when you get into bed, or when you first take off your socks. Yes, this can be just dry skin, but those areas are also where your circulation and nerves often speak up first. Poor blood flow from vein problems, long-standing diabetes, nerve damage, or even kidney or liver issues can all show up as itch, burning, tingling, or a restless feeling in the lower legs and feet. If you also notice numbness, pins and needles, changes in color or temperature, sores that heal slowly, or swelling that doesn't go away by morning, your body may be tapping you on the shoulder saying, "Don't ignore me." You do not need to panic, but you also do not have to scratch in silence. It is wise to mention this kind of persistent lower leg or foot itch to your doctor, especially if you have diabetes, vein problems, heart, or kidney disease. They can check your circulation, your nerves, your skin condition, and your medications, and help you sort out what is just dryness and what might be a sign that your legs and feet need more protection and care. Number 2, that mysterious itch on your upper back or shoulder blade area you can never quite reach. Many people over 60 have a favorite itchy spot on the upper back, usually between the shoulder blades or just off to one side. You might joke that you have worn out one spot on the doorframe scratching against it. The skin there may look almost normal to your eyes, maybe slightly darker or rougher, but nothing dramatic, yet the itch is deep, nagging, and seems to come from inside rather than the surface. This kind of itch is often blamed on dry skin alone, but in many older adults, it has more to do with the nerves and spine. There is even a medical name, notalgia paresthetica, for a chronic itchy patch on the mid to upper back caused by irritated or compressed nerves in that area. Years of posture changes, arthritis, discs settling, and muscles tightening can pinch the small nerves that serve a strip of skin, making it feel itchy, burning, or prickling, even when nothing much shows on the surface. This doesn't mean you have something terrible, but it does mean this itch is worth mentioning, especially if it has been there for months or years. If scratching never really satisfies it, or if you also have back or neck pain, stiffness, or changes in your posture. Sometimes simple changes, like gentle stretching, physical therapy, posture work, or targeted treatments, can help calm that nerve irritation. At the very least, your doctor or dermatologist can make sure there is nothing on the skin itself that needs attention, like a precancerous spot hiding in a hard-to-see place. If you are still listening, comment the number 2 below so we know you are here. And if these conversations matter to you, consider subscribing so we can keep creating calm, practical senior wisdom videos for older adults and their families. Now, let us move forward. Number 3. That one itchy spot or patch that keeps changing, crusting, or bleeding. This is the one that many older adults ignore the longest. Maybe it started as a small rough patch on your face, nose, ear, chest, or the back of your hand. Maybe it's a mole or brown spot you've had for years that suddenly feels itchier than usual. Maybe it's a little bump on your scalp or back that snags on your comb or clothes. You tell yourself, it's just a dry patch, or just a little scab, and you pick it. It heals a bit, then it comes right back in the same place, over and over. What matters here is not just that it itches, but that it doesn't behave like normal skin. It may itch or sting repeatedly in the same small area, scab, then bleed or ooze with very little provocation, look pearly, shiny, crusty, or have a rolled edge, change in color, shape, or size over months, refuse to fully heal no matter what cream you put on it. Not every itchy spot like this is cancer, but some skin cancers in older adults, including basal cell, squamous cell, and occasionally even melanoma, can start as annoying little itchy spots that people ignore or keep treating as eczema or old age skin for years. The same can be true for certain rashes or patches linked to internal illness. The rule of thumb is simple. Any itchy spot or patch that is new, changing, or not healing within a few weeks to a couple of months deserves a professional set of eyes, especially after 60. You are not bothering anyone by asking. You are giving yourself and your doctor the chance to catch something small before it becomes something big. You do not have to try to tell if it is serious yourself. Your job is to notice, this is not going away, and to say, I would like someone to look at this. Take note of how long it has been there, how it has changed, and whether it ever truly heals or just cycles between scabbing and itching. A quick skin exam could bring you peace of mind or catch something that needs treatment while it is still very manageable. When you know to pay special attention to these 3 itchy spots, lower legs and feet, upper back and shoulder area, and any single changing, non-healing itchy patch, you are not turning every itch into an emergency. You are simply treating your skin as part of your overall health, a messenger that deserves to be heard, not just scratched. Final thoughts. We have just taken a closer look at something most people laugh off or hide. 3 itchy spots after 60 that can be more than just dry skin. That stubborn itch on your lower legs and feet, the mysterious spot on your upper back you can never quite reach, and that one itchy patch that scabs, crusts, or bleeds and never seems to fully heal. None of this means that every itch is serious, or that you should panic every time your skin tingles. Aging skin is naturally drier and more sensitive, and a lot of everyday itch really is from soaps, weather, laundry detergents, or simple dryness. The key is not to become afraid of your own body, but to become more curious about it. Ask yourself gentle questions instead of brushing things off. Has this itch on my legs or feet been here for weeks or months? Do my legs also swell, change color, or feel numb or tingly? Has this upper back itch lived in the same exact spot for a long time, no matter what cream I use? Is there one particular spot that keeps scabbing, bleeding, or changing instead of truly healing? If the answer to one or more of those is yes, that is not a reason to be ashamed or embarrassed. It is a reason to write it down and bring it to your next appointment. Or, if it worries you, to call and say, I have an itchy area that is not going away, and I would like someone to take a look. Doctors and nurses would much rather you come in early, when things are small and easy to treat, than wait until you are in real trouble. You are not bothering anyone by speaking up. You are doing your job as the person who lives in your body every day. No one sees your skin as often or as closely as you do. You notice the patterns, the spots, the places you keep scratching. When you share that information, You and your healthcare team become partners instead of you trying to guess on your own. At the same time, you can be kind to your skin in everyday ways, using gentler soaps, lukewarm water instead of very hot, moisturizing after bathing, avoiding harsh scrubbing, wearing softer fabrics, and following your doctor's guidance if you have conditions like diabetes, vein disease, kidney or liver problems. These small habits do not just reduce itch, they help your skin stay stronger and more protective as you age. So ask yourself today, is there an itchy spot I have been ignoring for too long? If there is, let this be your quiet nudge to stop scratching in silence and start talking about it. One simple conversation could bring you peace of mind, or catch something early that truly needs attention. Both outcomes are worth it. In the comments below, if you feel comfortable, share which itchy area has bothered you the most: the lower legs and feet, the upper back, or that one stubborn patch, and whether you plan to have someone check it. Your honesty might be the reminder another senior needs to finally mention their own annoying little itch to a doctor. If you found this video helpful, please like, subscribe, and share it with a friend or family member over 60 who is always scratching the same spot and saying, "Oh, it's nothing." Your support helps us keep creating calm, practical, senior wisdom so older adults can listen to their bodies with less fear and more understanding. Thank you for watching. Treat every persistent itch not as an irritation to be ignored, but as a message to be heard. And remember, your skin is not just the outside of you, it is one of the ways your body speaks up to protect your life.